This tutorial reviews the wizards available for assessment in the lateral spine view. Choose procedure as deformity procedure, move over the spine and choose the spine assessment icon. No templates are shown and the AP or lateral or both images can be opened. Looking just at the lateral image, open X-ray. Under type of X-ray, match the lateral view to whichever image is appropriate. This is important for the correct measurements to be recorded later. Use quick scale and the marker ball and say it's a marker. Now in planning we will look at all of the wizards that have been provided for lateral assessment. These have been pre-positioned just to aid with the speed of the demonstration. To start, a simple cob angle wizard which will record any cob angles that are positioned, and similarly to the AP, if already seen, just take the handles and rest them across any vertebral bodies or areas of interest. This wizard is only available for a single measurement. Cob angle can be removed and we move to the preset position of the T2, T12 cob wizard, and changing the magnification we can see them in position. Once T2 and T12 are positioned, we can move to the next cob wizards T5 and T12. So using the T12 common point, it will already recognize this, and T5 is positioned manually by adjusting the end handles and of course zoom to the area as necessary. Removing T5, look at T10 to L2. It's necessary to scroll down on the image. Both of these have been manually positioned, and again these are fixed positions, so no selection is available for other vertebral bodies. Lastly, in the cob wizard group, the T12 S1 set. T12 is already recognized and S1 is positioned. All of the values and whether they represent a kyphosis or lordosis are recorded over here in the planning panel. So moving away from the cob wizards, now we review the balance wizard. Once again, the full image view is available. Sitting on C7 and S1, if S1 has already been positioned and recognized, the wizard will use this point. C7 has been positioned independently on the 4 points of the vertebral body. Any compensation or decompensation will be measured depending on its relationship with the S1 plumb line, whether it's anterior or posterior. And finally, the pelvic incidence wizard, which represents several different measures at one time, uses S1, which is already positioned, and the femoral head. Ideally these would be superimposed, although this is rarely possible, so it's possible to either estimate the midpoint and size, or if necessary, 2 circles can be drawn and a line tool divided to determine their center point. Once that's done, 3 measurements are automatically given: sacral slope, pelvic incidence and pelvic tilt. As with the AP, any wizards that are required to be visible in the final saved image should be replaced on the image before save or committing the image. This ends the tutorial on assessment in the lateral spine.